Type 1 diabetes is an autoimmune condition in which the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. People with type 1 diabetes require insulin therapy to manage their blood sugar levels. Here are key remedies and strategies for managing type 1 diabetes. Insulin therapy. Insulin injections. Administer insulin injections using syringes, insulin pens, or insulin pumps. Insulin pump. A small device that delivers a continuous supply of insulin, mimicking the function of a healthy pancreas. Blood sugar monitoring. Regularly check blood glucose levels using a glucose meter or continuous glucose monitoring (CGM) system. Adjust insulin doses based on blood sugar readings. Carbohydrate counting. Learn to count carbohydrates in foods and adjust insulin doses accordingly to maintain stable blood sugar levels. Meal planning. Follow a balanced diet that includes a variety of nutrient-rich foods, focusing on complex carbohydrates, lean proteins, and healthy fats. Distribute meals and snacks evenly throughout the day. Physical activity. Engage in regular exercise to improve insulin sensitivity and overall health. Monitor blood sugar before, during, and after exercise to make necessary adjustments. Education and support. Attend diabetes education classes to learn about self-care, insulin management, and coping strategies. Join support groups or connect with others living with type 1 diabetes for emotional and practical support. Emergency planning. Carry identification indicating your diabetes status. Educate family, friends, and coworkers about recognizing and responding to low blood sugar, hypoglycemia, and high blood sugar, hyperglycemia episodes. Regular medical checkups. Schedule regular appointments with an endocrinologist or healthcare provider who specializes in diabetes care. Monitor long-term health factors such as kidney function, eye health, and cardiovascular health. Mental and emotional health. Manage stress through relaxation techniques, mindfulness, and hobbies. Seek professional help if needed to address the emotional aspects of living with a chronic condition. Remember that type 1 diabetes requires consistent and vigilant management. Work closely with your healthcare team to develop a personalized diabetes management plan that meets your individual needs and goals. Additionally, advancements in diabetes technology, such as closed-loop insulin delivery systems, artificial pancreas, and continuous glucose monitoring, continue to improve the management of type 1 diabetes.